A very good morning. Dr. A.K. Vaishnavi, National Organizing Secretary, Anupriya Patel. Dr. Sanjeev Jha, President, Indian Association of Physiotherapists. Dr. Ruchi Vaishnavi, the Women's Head of IAP and also the Treasurer of the Association. Dr. Yagna Shukla, Chairperson, National Commission for Allied and Healthcare Professions. Dr. K.M. Annamalai, President, Physiotherapy Council, NCAHP, and also the General Secretary of the Association. Dr. Suresh Babu Reddy, who's the Vice President of the Association, and all the distinguished members of Indian Association of Physiotherapists, the eminent guests from the medical fraternity, my friends from the media, and I see a lot of students in front of me, so everybody who's a part of this esteemed gathering. I take immense delight in joining you all today for this very special occasion, the third national conference of the IAP Women's Cell and also Physiomanthan-2025. So my warmest greetings to the organizers for hosting this very, very significant dialogue, and particularly for the selection of theme of this conference, which is integration of physiotherapy in schools, sports and society. We at Government of India have a clear vision to create a Viksit Bharat by 2047. And when we say a developed India by 2047, health becomes one of the most important pillars. So how do we see India in 2047 when it comes to health? We see it as possessing a healthcare system which is inclusive, accessible, affordable. And what I see here today, that the theme that you have chosen, which is about integrating physiotherapy in schools, sports and society, that resonates with this vision of creating a healthcare system which is accessible, which is inclusive and which is sustainable as well. So congratulations once again for selecting this very, very pertinent topic of discussion during this conference. Well, I have noticed here in this hall, and otherwise what I learned from my brief interaction with physiotherapists, that this is a field which is dominated by women. So not just India, but even globally, we have 70% of the physiotherapists who are women. So I take immense pride as a woman myself that I am here addressing a conference of a field which is dominated by the feminine energy, I would say. And although I may not know the reason clearly why we have more women in physiotherapy, but I guess healing comes naturally to us if I talk philosophically. So congratulations to all the women who are advancing this very, very important field, which is today not just treating the physical body, not just the physical symptoms, but it is actually empowering individuals to lead life to the fullest. It is actually helping people to take charge of their health and well-being. So it's very important that we all contribute as policymakers, as practitioners, as students, as media, in whichever role we are, for the promotion and advancement of physiotherapy. Today, we can say that it is not something which pertains only to rehabilitation. It's become a bigger thing. It's playing a larger role of preventive healthcare. And today we have a new national health policy in India, the National Health Policy, which was rolled out in the year 2017, which makes healthcare all-encompassing. So healthcare is not just about curing a disease. Healthcare is about prevention, promotion. It's about cure. It's about a lot of things. So physiotherapy particularly focuses on prevention, health promotion and lifestyle management. This is how it is evolved. I just heard your president mention the term physiopathy. So that is the evolution of physiotherapy. It's just integration of everything together which enhances our quality of life. And India is often being lauded these days as the youngest nation. So we have a huge young population, people who are below the age of 35 years. 65% of our population, which we consider as a valuable resource because we feel that it is the youth of India who's going to actually lead or who's going to be a big resource for the entire globe. But at the same time, India is also going to have a big chunk of an aging population. So physiotherapy is going to be very useful, I mean of course for all age groups, but particularly for our aging population because mobility becomes an issue. Remaining independent becomes an issue. So that's where physiotherapy brings a whole lot of benefits. Also in the management of chronic conditions, it has an immense role to play. And I have personally benefited lately from physiotherapy, so I would advocate that more and more people must take help of our professionals whenever they are in a crisis where physiotherapy could intervene and help. Well, I have the president of the NSCHP here also, and you may all recall that in 2021, our government took a very important decision. We established this commission, which is fully functional now, and it has 10 different professional councils, one of which pertains to physiotherapy, of course. And it has also released different curriculums for all these different professions. And the biggest benefit of this overarching commission has been in terms of establishing and providing greater recognition to physiotherapy as a profession, also strengthening the regulatory systems. And today, we can say that physiotherapy has been able to secure its rightful place, not just in policy making, but also in healthcare delivery. And friends, today I can say that Government of India, when we have this larger goal of universal health coverage, for which we are also going on expanding our healthcare infrastructure, we strongly believe that the role of the physiotherapist is going to be even more crucial. Because now we would be needing our physiotherapists in multidisciplinary healthcare teams. Why? Because we want to achieve the best patient care outcomes. So that's where you're going to become more and more important. And another thing, slowly, the awareness about health and well-being is increasing. And people are also becoming more aware about the relevance of physiotherapy. So in times to come, as we move towards Viksit Bharat, in both rural and urban settings, the demand for the physiotherapy services is going to increase manifold. So I think it is very timely to hold such a conference and bring about this exchange of ideas. I also note that a health expo has been organized for the first time, where you would be showcasing some latest innovative technologies which are now being used worldwide, and it is a very, very good learning experience, not just for the practitioners but also for the students. And if you have general public also who would be visiting this expo, I think it will help a lot in increasing their awareness also how these innovative technologies and these equipments and devices which have now come are helping patients in providing relief and healing their pain. So it's a very, very good effort. I really appreciate. We also happened to witness the release of a very important book today. It's a neurological guidelines for physiotherapy. So I commend you for releasing that book, because that will really help the practitioners as well as the patients and the families who are trying to navigate through this challenge. I have also learned that you are going to be starting a new initiative, which is community-based posture education program. I think it's a wonderful initiative, because in today's times, each of us is facing that challenge. So, reaching out to the schools, reaching out to the colleges, workplaces, interacting with the youngsters, and especially in schools, when you start teaching children how to maintain a good posture, it is really going to bring huge benefits. And children today, the way they are stuck to the mobile screens and their iPads and laptops, all of them are gradually developing the posture issues. And it's very important to safeguard our future generation from musculoskeletal disorders. So once again, my sincerest appreciation for launching this community-based posture education program today. I also learned that IAP has decided to host Asia West Pacific Physiotherapy Conference next year in India. So that's really a commendable effort to reinforce India's image as a leader when it comes to physiotherapy all over the world. So congratulations for that as well. I'm sure this conference will see a meaningful exchange of ideas, lots of sharing of good knowledge, and you will come out with a report also. So we would like to go through your recommendations also, because we're trying our level best to make healthcare system more and more inclusive, accessible and affordable, and overall improve the patient care outcomes. So maybe we'll have some recommendations which will help us to revisit our policies and strategies, so there could be a better integration of physiotherapy wherever it's necessary. So with this, I will once again congratulate the organizers, and I wish this event, this conference, a great success. All the best to all the participants, and thank you very much IAP Women's Cell for having me here. Jai Hind, Jai Bharat.